Cervical cancer is a cancer of medically underserved women. These are poor women. It's not a very common cancer. There's only about 13,000 cases in the United States. The current device, the interstitial template, has not changed in design since about the 1960s. It's an externally placed applicator that is sewn onto the perineum, and the needles, when they're introduced, go through a significant amount of perineal perivaginal tissue, and the needles introduce a lot of trauma on the way in and the way out. Basically, every day for the past 5 years when I've used the device, I thought there's got to be a better way of doing this. Right now, there's a lot of places that have stopped doing brachytherapy because the skill set of the practitioners is very highly dependent on the training and the time to learn how to do these cases. Unfortunately, we do know that brachytherapy is the only curative mechanism for cervical cancer. I approached Rice knowing a little bit about the Rice 360 Institute and the types of problems that they address. And Dr. Hanania, one of my residents and collaborators on the study, knew a little bit about the Rice capstone design program. When we decided to apply in September, we had no idea that 9 months later we would be sitting here with a prototype that exceeds any of the commercially available applicators. I like the fact that the UFO is customizable in terms of not only the depth, but the ability to have either a tandem for an intact uterus or a needle for a patient who is post-hysterectomy and has a vaginal cuff recurrence. The length of the applicator is customizable, as is the width of the applicator, which is appropriate since cancers and the goals of treatment are different for different patients. The UFO would significantly shorten the intraoperative time. Right now, the procedure takes about 2.5 hours for the needle placement, and a lot of that has to do with the fact that you're blindly inserting the needle through a significant amount of tissue. The UFO allows for better visualization of the needles with less penetration through normal tissue. I think that this device would make brachytherapy, interstitial brachytherapy, a little bit less intimidating for practitioners who maybe don't see a significant amount of case volume. I think this would facilitate the ability for patients to be able to be treated with more advanced cervical cancers in regions that maybe don't typically have access to care. There's really nothing currently on the market like this. There's a device that is supposed to come to the market in fall of 2020 that may have been delayed due to coronavirus, but that applicator is not customizable, it is not anatomically shaped, and it did not have the option for having a tandem or an internal needle. It's something that would be, I imagine, I haven't seen the final price of it, but I imagine would be cost prohibitive for a lot of centers around the world that are treating high volume cases. I think that this device would allow practitioners to be able to easily use it and be comfortable with placement of the needles and hopefully improve access to care.
Brachytherapy is a crucial part of curative treatment for women with locally advanced cervical cancer. And in our clinic, we were getting frustrated because essentially it was a one-size-fits-all approach where we had to perform these extremely complex and invasive procedures for all patients, regardless of their individualized disease. Dr. Ludwig and I realized that there are certain patients that could benefit from a device that allowed for a less invasive approach that could be done in a shorter amount of time and would also be more cost effective. We were frustrated with the lack of options as far as what was available commercially, and our next idea was to create our own device, and we needed a group of motivated individuals to help us achieve that goal. Unfortunately, brachytherapy, at least in the United States, has never been a procedure that reimburses very well. For many companies that provide radiation equipment like linear accelerators, brachytherapy is not the overwhelming part of their profitability. As such, brachytherapy is kind of more of usually an add-on and kind of included in certain packages, but it's never really something that sells the very expensive radiation equipment. I think that might be one reason why we don't see as much innovation in the brachytherapy realm. Another is also because, and thankfully in the United States, the amount of locally advanced cervical cancer has gone down and is relatively lower than much of the rest of the world. However, in certain areas, such as in our clinic, which is a safety net hospital, we still see patients who are underinsured or have no insurance, and they still have very advanced disease, and we still have a very high volume of cases. So there are definitely parts, not just around the world, but here in our hometown, that would benefit from brachytherapy devices that make the procedure better for patients and better for doctors. What I really appreciate about the UFO design is that it will allow us to have very consistent implants. When we use an external base template, your needles really had a lot of variability as far as how they may go in and what course they may take once they've actually entered the body. Having all the needles within the obturator until they reach the area of the cervix, I think, as is shown by some of the testing that the students have done, is going to lead to, I think, higher quality implants that vary less amongst different practitioners, and ultimately a robust design that provides a high level of assurance that the treatment that we're delivering is focused and accurate and highly conformal. Unlike what's on the market today, which is essentially applicators that are meant for either extremely minimal disease or kind of what we have been using for patients with larger disease, which is the SIAD template. The UFO is something that's in between, that allows for certain patients to have less needles used to implant the tumor, causing less toxicity. While there are some hybrid applicators on the market, many of them are very expensive, and quite honestly, having examined a few of them with Dr. Ludwig, I actually feel the UFO is much easier to use than some of the current options on the market. Given the very low cost of producing the UFO and the number of patients, at least in our clinic, it could be used for, I really hope and can foresee the UFO becoming implemented not just here in our clinic, for which we are starting to clinically investigate it. It's currently in kind of a pre-patient phase where we're doing all the appropriate quality assurance, but hopefully in the future we will actually be able to treat patients with this device. But for the future of the device itself, I hope that it will be successful, and I can see it being successful and implemented not just domestically, but hopefully also abroad. The one remarkable thing about this design is that it was all created to initially be 3D printed, so that design could be shared readily and quickly with people all over the world.